Assalamu alaikum. Welcome back. You're listening to the Mariam Mukunda Show on Salam Media. Okay, moving along, I've got Rosina Mohammed on the line, who is a clinical psychologist to talk about personality disorders. You're probably wondering what is a personality disorder, or you're probably wondering if you have a personality disorder. Stay tuned because you might get some much needed information. Let's chat to Rosina. Assalamu alaikum, Rosina.
Walaikum salam. How are you, Mariam?
Alhamdulillah, all good in yourself.
I'm good, thanks.
All right, first start off by defining a personality disorder. What exactly is it?
So personality is a way of thinking, feeling, and the way a person behaves. So personality disorder would be unhealthy thinking patterns or rigid thinking patterns, or the way someone would feel or behave that usually goes or deviates against the expectations of culture, and causes a lot of distress or problems in functioning of an individual over time.
Waking up, I can smell the shop brewing. So you know I'm heading straight to the kitchen. I know hell, don't forget the kharfo that tastes on my tongue. It reminds me of the halwa. The best feeling I had ever known. 10 siblings gathered in a single home. Ain't nobody hold it down like Hoyo. You never made it seem like it was difficult. Always had a smile on your face. The trails of your tears, you ain't never left a trace. Those bitter situations you didn't want us to taste. So growing up was sweet like the sun in Somalia. Lately I've been restless, missing you. But I can't even go back home. I've been getting on me.
All right, I apologize for that. Well, bad network comes at any given time, so please expect it, but also please accept our apologies. Still on the line, I've got Rosina Mohammed, who is an educational psychologist, and we are talking about personality disorders. Rosina, sorry about that earlier. Can you just please repeat what you just said about what a personality disorder is?
Sure, gee, no problem. I know with people working from home, the network can really just come and go at
Mm,
any time. So, like I mentioned, personality is a way of thinking, feeling, and the way an individual behaves. So, in essence, a personality disorder would then be an ineffective way of thinking. So, usually, personality disorders involve very rigid thinking styles, distressing feelings and emotions, which lead to unhealthy behaviors. And usually, personality disorders are characterized by thoughts, feelings, and behaviors that deviate from the acceptable expectations that would be acceptable in culture, and would cause a lot of distress or problems in a person's functioning over time.
mhm. Okay, so there are different personality disorders out there. Can you elaborate on the most common ones?
Gee, sure. So there are different clusters of personalities that we would consider. But in order to just make it easy for people to understand, we usually have the suspicious personality disorders, the emotional and impulsive personality disorders, and the anxious personality disorders. So, the most common ones that we tend to see in individuals, usually the emotional and impulsive types, which are borderline personality disorders or narcissistic personality disorders, and the anxious types, which is avoidant, dependent, or obsessive compulsive personality disorders. And each personality disorder is characterized by a specific set of diagnostic criteria or symptoms. And in order to meet the diagnostic criteria or the diagnosis for each personality disorder, you'd need to be characterized with at least a minimum number of symptoms in each of these diagnoses.
Okay, let's talk about those symptoms and how people can identify whether they have a specific personality disorder.
Sure. So let's take borderline personality disorder for an example. It's usually characterized by a pattern of instability in one's personal relationships. They tend to experience intense emotions, poor self-image, and impulsivity. There's often it's also influenced by the fear of being abandoned, or there seems to be this intense spectrum where they either have intense sadness or perhaps intense fear, and also can be characterized by feelings of feeling empty, and even
Rosina, your
self-harm.
camera is off. I can't see you.
Oh, sorry, Ma. Is that okay?
Yeah.
There we
Yes.
go. Yes, so that's borderline personality disorder. I think because there's so many, just to highlight in terms of the various areas that one would look at, whether it's a doctor or a specialist or a psychologist that will assess to see if one is can be diagnosed with a personality disorder. We would often look at how they think about themselves and others. How would they respond to different scenarios or people emotionally? How do they relate to other people? And how do they control their own behavior, whether it's under extreme stress, or we all have different triggers on a day-to-day basis. So how do they respond to those kind of stresses in their day-to-day lives? And also, to what extent are all of these symptoms impacting their functioning? So often we'll, depending on the age group, so usually with personality disorders, we're only able to start seeing the development of personality disorder from teenage years, and usually only diagnosed in more young adult life or older. Reason being is kids are still personalities are still being developed as they grow. So it's only really by young adult life, when you've developed your unique personality, that we're able to see the pervasive symptoms that one would experience, and that's unique to that individual. The other thing to note with personality disorders is that the symptoms can be classified on a spectrum, meaning that we all tend to have certain traits of different personality disorders. We all tend to sometimes be narcissistic or histrionic, needing attention, or even borderline, so being very impulsive. But depending on where the symptoms lie on the spectrum, so very high and pervasive, meaning existing for a long period of time, and it starts to impact your ability to function at work or to be a contributing member of society in the normal sense, is when we would then consider an individual to be properly assessed to see if they can be diagnosed and then appropriate treatment being given.
Okay. Now, is it possible for someone to have a combination of these disorders? I mean, you just mentioned that we all can have a multitude, a bit of everything. But now, if a person is diagnosed by a professional, can they have a combination of these disorders?
Yes, so it's very rare to find individuals who have multiple personality disorders. But what we do find common is a personality disorder, perhaps with a comorbidity of substance abuse, or other mental health disorders. whether it's a neurodevelopmental issue or a learning issue, something like that. So it is normal to see personality disorders comorbid with other issues, but very rare with another personality disorder. And if to make sense of that, usually, it's almost like what came first, the chicken or the egg. So in young individuals who tend to resort to unhealthy behaviors like substances or maybe even provocative behaviors, things like that, it can, and if they have an underlying personality disorder, it can sort of bring it up to the fore under extreme stress. Or sometimes they already have symptoms of a personality disorder, and in order to cope with the difficulties of the personality disorder, especially if it's gone undiagnosed and untreated, then you start to find that they develop comorbid disorders like substance abuse.
Okay, let's talk about the treatments, if there is a treatment for personality disorder, and what goes on in that treatment.
Sure. So personality disorder, unfortunately, it would be considered as a chronic disorder, meaning that it's something that you might have to live with for the rest of your life. But there are various treatments and various ways that one can engage in or receive in order to help an individual become more functioning in their lives and to manage their behavior so that they can feel safe both to themselves and to the people around them. So generally, what one would the first step is to see a doctor. So usually a physical exam where they would ask you in-depth questions about your problem. They would perhaps go in for lab tests and screening tests, things like that. And the reason for that is we always want to rule out any medical or biological issues. Then we tend to send them for psychiatric evaluation. So this includes assessing their thoughts, their feelings, their behaviors, and we used various psychological tests that help us to pinpoint a specific diagnosis. And then based on the symptoms that they're experiencing, we would be able to diagnose them. Once we're able to get a diagnosis, the various treatment methods is usually psychotherapy, so long-term therapy with a psychologist, and I would recommend seeing a psychologist who usually specializes in personality disorders because it's quite challenging treating personality disorders. And they would generally tend to teach you things like social skills training, so learning how to, getting some insight and knowledge in learning healthier ways to manage your symptoms, reduce your unhealthy behaviors, that can interfere with your functioning in your relationships and how you relate to other people. They would also help you to understand your triggers, your emotions, what leads you to feel certain emotions, and how to address those specific emotions. There's also, in some severe cases, medication that is, we would refer you to a psychiatrist where they would then help you consider going on to medication. So either antidepressants, if you're showing depressed moods, impulsivity, irritability, hopeless feelings, which are all associated with personality disorders. Sometimes mood stabilizers, antipsychotic medications, and anti-anxiety medications. And then in some severe cases, admission to a hospital or residential treatment programs. So usually this treatment method is encouraged when an individual is not able to care for themselves properly and they are in immediate danger of harming themselves or people close to them. We usually encourage admission to a hospital. It could be a day hospital program or attending an outpatient treatment or even maybe hospitalization for a few days where they can then be stabilized and then take part of a therapeutic program, things like cognitive behavioral therapy or dialectical behavioral therapy. These types of therapies are specifically designed to address behavior and emotions.
Okay. Is it possible for a person to develop a personality disorder after a traumatic experience, perhaps maybe an accident or a divorce or whatever may have been?
Gee. Look, personality disorders are so complex, and there's so many various different things that can affect or that can lead to one developing a personality disorder, especially if you're already susceptible to one. So specifically, if your genetic makeup or your genetic code, meaning that someone in the family has already been diagnosed with a personality disorder, then yes, your environment is very important. So any type of traumatic a traumatic incident or even an unhealthy environment can definitely impact and lead to or certain events or unhealthy relationships that you might have with people. And a combination with your genetic makeup, you might see that you become more vulnerable to developing a personality disorder, or sometimes, like you mentioned, a life situation like a divorce or an accident can trigger the actual development of a personality disorder. So there are various risk factors that are involved. So family history, like I mentioned, if there are other mental illnesses, abusive or unstable or chaotic family life during childhood or young adult life, and variations of brain chemistry and structure. So sometimes with car accidents or traumatic brain injuries, we tend to find personality changes in certain individuals. Sometimes it's more long lasting, and other cases it's just for a short period of time, and then with treatment you're able to see that they're able to bounce back or become resilient to the impact of the trauma.
What about a bipolar disorder? Is it considered as a personality disorder?
Bipolar disorder definitely is part of one of the clusters. It's more specifically in relation to mood. So bipolar disorder is classified around mood shifts. So mood shifts ranging from extreme depression to mania, so being very energetic, impulsive, or very happy, so to speak. And if untreated, you'll see that the changes in mood is can experience in episodes, so generally within 2-week periods, and can impact a person's life quite severely.
All right. And finally, um, is personality disorder a mental disorder?
Yes, a personality disorder is classified as a mental health disorder. And we should definitely talk more about it so that we can shift away from the stigma that there's something wrong with people if they have a personality disorder. Because the less we talk about this, the more likely we're going to see individuals who are suffering with personality disorders and they're not seeking treatment. When in today's time, specifically with all of the treatment methods that are coming up and research being done, that individuals with personality disorders can live really healthy, fulfilling lives. And they're capable of having healthy relationships and having families. So we should encourage people to seek treatment.
I think that one of the stigmas and misconceptions around a mental health disorder is that people need to see you mental and then they'll take you seriously to say,
Yes.
no,
Yeah.
this person is really sick. But I mean, if you don't show the signs of being mental, but you are really sick, then why don't
Yeah.
people take it seriously as well?
I think that's the difficulty we're having with mental health in general, is because it's not very visible that someone is hurting or they're not doing well. We tend to take it less lightly. Whereas if you have a broken arm or a cut or bruise, you'll find that people take that more seriously. So I think the same way how we advocate for how you go every year for your flu vaccine, mental health should be treated in the same way. There's nothing wrong with seeing a therapist every now and then, just to make sure that you're engaging in healthy thinking patterns, you're managing your emotions in a healthy way, especially now considering that the context we're living in. There's a lot of research showing that we anticipating a mental health pandemic. So we should definitely encourage people to start being proactive around mental health.
Okay. Well, shukran so much for your time, Rosina, and for the chat. Hopefully, the information that you shared will be taken and used wisely by our listeners and our viewers. And whoever needs more information, how can they get hold of you?
They can send me an email on info@rosinapsychologist.com, or they can give me a call on 071 141 9141. I also have a practice based at the Wanderer Sports Medical Center. And if you just go onto the website, they're able to find my details there.
All right. So shukran so much, and have a wonderful day. Assalamu alaikum.
Jazakallah so much. It's a pleasure.
Right, so that was educational psychologist Rosina Mohammed giving us some tips on personality disorders. You probably are not very familiar with a personality disorder, but yeah, it is something. It's a broad spectrum of disorders. So you might not know if you have a personality disorder, but if you read up on it and if there are some of the symptoms or signs that you may exhibit, you need to go to a professional just to go for a proper diagnosis or checkup, and they'll let you know exactly whether you have a personality disorder or not. You can find Rosina at the Wanderers Sports Medical Center. You can also give her a call on 011 419 141, and you can also send her an email to info@Rosina. Rosina, that's spelled as RAZEENAH. Don't forget the H at the end. Psychologist.com. That's info@rosinapsychologist.com. If you have any further questions, you may leave them in the comment section below, or you can send them to us on WhatsApp on 0617660355. Rosina's number is also on screen. You may send them to her and she'll be glad to answer them, inshallah. For now, do stay with us. We will be back after the break.